I can't thank St. Peter's and Albany Med enough for what they're doing. And as this continues on, and I said it, when we started March 12th and we started with 2 cases, we're now up to 89. So our number changed from yesterday, and if you heard the doctor and I talking, going back and forth, things changed because we're over 20 this morning, and we went down a little bit because 2 of the cases belong to another county. So they moved out, and that's going to change throughout the day because now we're getting the testing back that they've been doing. And as Governor Cuomo said, as we ramped up testing more in New York State than anywhere else, we have a lot of negatives, but we're going to find all the positives. And there's testing still is going to continue on, so I want to make that clear to everyone. But it's going to be prioritized. It's going to be basically, you're not just going to be able to go in and get a test because you don't feel good. The doctors are going to see what signs and symptoms you have to see whether or not you should get a test. And if they feel you should, they're going to give the test. So it's not like St. Peter's, because I think that was a lot of misinformation getting out. A lot of people thought St. Peter's and Albany Med was shutting down, but Albany Med's going to still continue to go forward, but you're going to be prioritized as this continues to grow. You have to be ready for emergencies and make sure you have the right supplies. And I want to say this, the last couple of years, Department of Health went through this accreditation under Liza's leadership, and it took 2 years to get it, and we're only 1 of 6 that have it in the state of New York. But most importantly is being prepared. And I know as people are looking for N95 masks, a lot of the EMS community here in this county and fire and didn't have them. Why stock them? Who thought we were going to have this? So in St. Peter's was running low in Albany Med. So we gave out, I believe, 5,000 masks yesterday, Liza? 5,000 N95 masks to St. Peter's, to the EMS community, to make sure that their first responders are prepared and that they're protective. Because without the proper PPE, if we lose that front line of defense before they even get to the hospital, it's going to break down. So I do want to say, hey, look, we're ready, and we're going to be prioritizing things as we continue to move forward. But I can't thank the emergency services as a whole out there every day. If you have symptoms, call your doctor. Like I said, they're still being tested, done as prioritized by our risk factors, and your doctor will make that decision. But we need to follow the governor's mandating, and basically the governor's last executive order are requiring all non-essential businesses to close their office, personal sites completely tomorrow night by 8 p.m. As I drove around last night, going around the community, there was one person had about 20 kids out in front of their house, continuing on like it was a regular day. There's a reason the governor and everyone's putting this out there. Please, 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 by all means, abide by it. Make sure that you're keeping your social distance. There's reasons for everything. And when it comes to essential employees, I can break that down if the press has any questions on that, because we've gotten a lot of questions on that too. Even like our laundromat's essential, our liquor store is essential, tanning salon's essential. No, we know what essential is. Let's look at it and take a step back. But most importantly, I keep emphasizing this. Everyone just needs to remain calm. This is the new normal, people. This is the new normal, and it's going to be this way for a couple of months. Yes, I said it. It's going to be this way for a couple of months. This is going to. We're not even at the tip of this yet. If you look at what's going on in Orange County, that was right outside Westchester, what's going on Dutchess, which is right outside Orange, it's slowly moving up here. And by doing social isolation, you slow it down. You're not going to prevent it. You're going to slow it down. And that's what we're trying to do, because we're not trying to overload our hospitals. So the more you socially isolate yourselves and stay away, the easier this will be. Now, we have to do things differently, when it comes to gatherings, even with families, and Liza will talk about that. You got older people over the age of 70, they should be wearing masks. If you have to socialize and people got to come over your home. It was my wife's birthday. I was going to have her a huge party, but I had to cancel it. But people drove by in cars just beating the horn saying happy birthday. It was funny, it was comical, but that's the new norm. You know, we had a fire last night in the yard and they spread out 6 feet. Everyone was 6 feet away from each other. That's what you have to do. It's different times we're in, and different times we need to stand up and take care of one another. And I can't thank everyone enough, all the business owners and everyone in Albany County that have been doing that have continued to do that, and will continue to do that. And just to let everyone know, if we end up going to a complete shutdown, government still has to run. We still have vital services. Hospitals don't shut, jails don't shut, EMS service doesn't shut down, fire, police. So when you think of a complete shutdown and shelter in place, if it comes to that, Dr. Whalen's not going to be able to do that. Her and her staff still have to continue to do their job at the Department of Health. So keep that in mind. And we made arrangements with a lot of Hannafords and a lot of different places to have food stored around so we can get food out to people if it goes on forever, and we put them mechanisms into place. But one of the other things, we've been getting a lot of phone calls from our Department of Mental Health, the support line that we established a couple days ago. If you're struggling with stress, anxiety, even depression, call this number, 518-269-6634, 518-269-6634. And I want to say to everyone, please, stop reading everything on Facebook and the internet. Stop getting yourself worked up. If there's a cure, I can assure you Dr. Whalen's going to stand there and let you know, and before she does it, there's going to be 1,000 other people that are going to stand up and tell you we have a cure, or this is working, or the protocols. Get your information from the CDC. Get it from a reliable source. And don't buy anything online that says this can prevent it. Trust me, we'll give you the information as it comes out. But before I turn over to Dr. Whalen, we are up to 89 confirmed positive cases, and that will grow. We'll probably be well over 100 by Monday morning. There's 386 people under mandatory quarantine, and we're up to 571 people under precaution quarantine. So them numbers fluctuate as someone comes off, someone goes on, or as they're doing the mapping and tracing. So again, this is going to be different times we're in. Remain calm, look towards your leaders, look towards your community people, your pillars in the community, take guidance, and trust me, let's be the good Albany County residents that we are and take care of everyone. Dr. Whalen?
Thank you, County Executive McCoy. As the County Executive has just stated, we have 89 confirmed positives in Albany County. We spoke yesterday about the fact that the testing capabilities have been restricted and will be modified by local hospitals. And again, I want to reassert what the County Executive said. This does not mean that there is not testing available, but the testing has to be directed to where it's needed most. So this will be patients that likely require inpatient hospitalization. So patients that have illness consistent with COVID-19 that are sick enough to be in the hospital. We also need to protect our healthcare workers. So those healthcare workers that are exposed will have testing as needed so that we can ensure that that workforce can continue to function for us. I am surprised in my conversations with people that there are still those out there that don't get it, that don't get the importance of staying at home. Someone said yesterday to me, we should just let this run its course. If we had started to let this run its course from the beginning, maybe we'd be through it by now. That does not make sense. And if we decided to let this run its course, we would have much more severe effects throughout the community, and we would likely have a complete overwhelm of our hospital and healthcare systems. Again, I reassert to people the importance and the individual mandate on each and every one of you is to stay home. Your staying home is saving a life. I've seen a social media campaign, please stay home because we can't. There are healthcare workers that are essential, frontline workers that need to be at their jobs in the hospital every day. You are protecting them by staying at home. Please know the importance of this. The social mitigation strategies that we are continuing to discuss are to keep that curve lowered. We know that people will continue to be infected, but the rate of infection will slow so that we don't overwhelm our hospital systems. This is essential if we are to get through this. So again, I say to all that are watching and listening, stay at home. Stay at home. As the guidance has changed with respect to being able to test symptomatic people, we do encourage those that have symptoms to contact their doctors, although the doctors may not be able to see them. The likelihood is that 80% of people that contract this virus will be able to be managed at home and will be fine. So in those cases, we will be happy to be a resource as well for people that are concerned that they have members at home that are sick and want to know how to care for them. There are resources on the CDC webpage on how to care at home for someone with COVID-19. And certainly, if someone gets into difficulty where they feel they cannot be managed at home, or their symptoms get to the point where they need urgent medical assistance, those services are still available. So utilize those channels if you need them. We are continuing to contact trace on the cases that came in. Because there is a 2 to 3 day lag sometimes with getting test results, even though the testing for the large-scale testing stopped yesterday, we are still getting those results. So that's why we got 18 last night, and it won't be surprising tonight if we get a similar amount. Starting Monday and Tuesday, because that testing is not available, we may not see numbers as high as we are seeing now. Again, the public needs to know this is not a reason for celebration. It's not a reason for comfort. It is simply a reflection of the fact that we are not doing widespread testing. The likelihood is we are just at the start of this outbreak in the community. So if you see the numbers go down, it does not mean that this is over. Please continue to heed advice to stay home. Contact us. Utilize the web resources that we have at the Albany County and Albany County Department of Health website, as well as the New York State Department of Health and CDC. And we look forward to continuing to work with you through this.